This video is going to focus on how you would write an ECG interpretation when the dominant pacemaker is located in the ventricles. Ventricular dysrhythmias follow the same format when you're writing their interpretations from an ECG. Some of the slight variations that are peculiar to a ventricular dysrhythmia is sometimes how we name the pacemaker. For example, it could be called an idioventricular rhythm, or it could be called a ventricular rhythm. Some examples would be idioventricular rhythm, which is a very slow rhythm, or ventricular tachycardia or ventricular fibrillation to some of the faster rhythms. The heart rate has some exceptions, not so much on how you find them. You find them the same way, but what's required in my class when you have some of these ventricular dysrhythmias. I don't always require a heart rate in your answer to get full credit when we're talking about especially the ventricular tachycardias and even the idioventricular rhythm, which is very slow. One reason for the idioventricular rhythm is that it's such a slow rhythm that I don't want you to waste a lot of time trying to figure that out, because it's really pretty much meaningless to your interpretation of an idioventricular rhythm. We're just going to look at this for a second. This strip may find its way to a quiz question that you were asked to write your interpretation. The first thing you're going to do is you're going to determine, like we've done with all the rest, is what is a dominant pacemaker. You're going to look and see that there are no P waves, so it's not a sinus rhythm. Could it be a junctional rhythm? There are no P waves on a junctional rhythm. The only problem here is that in a junctional rhythm, you have a normal appearing QRS complex, and this doesn't. So this would fall into the category of a ventricular pacemaker as a dominant pacemaker in this strip. No P waves, and the all ventricular dysrhythmias have abnormally wide QRS. Another example would be this. This is a idioventricular rhythm, but because it's over 40 beats per minute, people will call this an accelerated idioventricular rhythm. Some cardiologists will call this a slow ventricular tachycardia, and I will accept either description to get full credit on the dominant pacemaker in a ventricular dysrhythmia. The third example shows a ventricular tachycardia. Again, the determination of the heart rate, if this was a quiz question, I would tell you don't worry about it. However, if you had to calculate the heart rate, you do it the same way as with all the ECG strips we've gone over. Easier in the interval method to find a R wave peak right on a dark vertical line. Find the next R wave peak on a following dark vertical line. And if you know if this is the starting point, that your first set of numbers is going to be 300. And so this would be a ventricular tachycardia with a heart rate of 300. One other reason that I don't stress the determination of a heart rate in some of the ventricular tachycardias is because we get into ventricular fibrillation. This is ventricular fibrillation. The reason I don't care about the heart rate is because usually there is none with a patient that has ventricular fibrillation. The heart is beating, but it's not efficient enough to cause a pulse. As with all the dysrhythmias, you can have the dominant pacemaker in the ventricle, or You can have another dominant pacemaker, say a sinus or SA node, and have a ventricular dysrhythmia within that dominant pattern. So we have here an example of a good question that you will probably see in the quiz, and you will handle it the same way you've handled them all. Number one, what is a dominant pacemaker? If we look, we find a P wave, P wave, P wave. So we know this is a sinus rhythm. Next step, what's the heart rate? Heart rate is approximately 100 beats per minute. If you divide the small boxes into 1500, I think it really comes out to be 90, but 100 is close enough. Third step is there any other abnormality seen in the strip? And there is. This single beat is a PVC, premature ventricular contraction. So if you saw this in a quiz and were asked for your interpretation, the correct answer would be sinus rhythm, heart rate of 100 with a single PVC. Again, the pattern's about the same. There's a few little distinctions that we see in the ventricular dysrhythmias, but the mechanics are the same. If you have any questions or you're not sure about a certain point here, please contact me. I would be happy to go over anything that you had. Thank you.